Whatever we humans use, produce, leave behind, it just doesn't go down the drain. It just doesn't ruin the Chesapeake. It comes back and gets into your body.
That was Allen Press author Bob Musil, and this is Jennifer Pullinger, e-content editor at Allen Press. We're located on the web at allenpress.org. Here you'll find more great podcasts, plus our blog, Allen Interactive, and numerous other media and downloads. Allen Press has been a trusted source of environmental information and solutions since 1984. Bob Musil is the former executive director of the Nobel Prize-winning Physicians for Social Responsibility and presently an adjunct professor at the American University School of International Service. He's also a contributor to the Allen Press book, Ignition, What You Can Do to Fight Global Warming and Spark a Movement. Bob visits with us in our Washington, D.C. offices to talk about how looking at climate change through a public health perspective makes the issue that much more immediate. How exactly is climate change a threat to human health?
There are a number of ways that climate change is a threat to human health. They're direct and indirect. Directly, obviously, if things get warmer or hotter, and there are a lot of more heat waves, we see deaths from heat exposure, essentially. And they are likely to be 6 times as much if we keep on our current path. That's an example of a direct effect. An indirect effect would be malaria is spreading in Africa. As temperatures rise, mosquitoes are happier. They have more sex. They reproduce more quickly. They bite. It's transmitted more, and we're likely to see more malaria, which currently is killing 1 to 2 million people a year, mostly in the developing world, mostly young and vulnerable folks. There's also a lot of injuries and deaths from flooding, and we've seen a lot of that. But one of the worst effects here in the United States is from increased air pollution. Quite simply, as it gets warmer, you get more ozone pollution. It affects the lungs, cardiovascular disease. So all in all, there's a whole host of ways that increased temperature and disrupted climate on this planet make it harder for humans who've adapted to the environment we've got to stay healthy.
In Ignition, you say we need to reframe the issue of the environment and human health. What do you mean by that, by reframing?
Well, reframing, it's a term of art, I guess, to frame things. It's George Lakoff and others have written about how our brain uses what we might call stereotypes or metaphors or leaps to figure out how to think very, very quickly. Cognitive science tells us that. In common sense, if you say environmentalists, because of the attacks that have been on environmentalists, a lot of people will say, you mean those tree-hugging elitist SOBs who only care about natural parks? I got a job to worry about. Reframing means let's cast it in a different way. So when we're talking about your kids and their asthma, or dad who might get a heart attack, it's a whole different conversation. The mind opens up on a different track. And that's what I've tried to do in this chapter in Ignition, is get people to think about the impact of climate on their families, their kids, their communities, and not necessarily penguins and polar bears and ice.
And you also say that the environment is not just all around us, it's inside us, which many people may not think in those terms. What do you mean by that?
Well, that's not to wax philosophical. When you say the environment, you're describing an object, a thing that is different than humans. It's out there. It is the environment. It leads to a philosophical or thinking about the notion that we're not part of the environment, or it's easy to say the environment is bunnies and woods. When I say it's inside us, we now know through biomedical research, from medical engineering, we can measure things inside human cells. We can see that tiny molecules get transported up into the Arctic. They enter into the breast milk of a nursing mother, across and enters the child, the embryo, and can cause developmental problems. These are things we couldn't even see that are microscopic, that changes are happening in our body. Air pollution is another good example. You can't even see some of the particulates, fine little things that go down into the alveoli. They're the size of a red blood cell and get immediately into your bloodstream when they are emitted from a coal-fired power plant. That's what I mean. Whatever we humans use, produce, leave behind, it just doesn't go down the drain. It just doesn't ruin the Chesapeake. It comes back and gets into your body.
And where on the globe will we see the worst effects occur of climate change on public health, in America or in third world countries?
Well, unfortunately, the effects are strongest with the poorest, the most vulnerable in the developing world. I mentioned malaria. It's spreading. It's a deadly killer in sub-Saharan Africa. There are a number of diseases that are exacerbated through climate change. Waterborne diseases, again, developing world. There's a lot of potential disasters from flooding. And again, when you don't have the infrastructure or the economy, in Honduras, for example, an increased strong Hurricane Mitch in 1998. There were 11,000 people killed, 30,000 cases of malaria, 30,000 cases of cholera in a country the size of Iowa. But I've written about the United States because we are the biggest part of the emissions problem. We're the biggest hope for a solution if we would just turn around and get new kinds of energy. So I try to talk to Americans that it's going to affect them too, and that's why we talk about air pollution, pollution that enters into mother's breast milk and through the food chain, so that, again, it's not just those. I love penguins and polar bears, but it's also about your neighbors and your family.
What is the public health community's strategy for tackling this problem?
Well, there are a number of strategies. First of all, is linking up with families and communities who are affected by air pollution, by mercury. I ran a group called Physicians for Social Responsibility. We did huge campaigns in which we reached out to women of childbearing age, nursing mothers, in food magazines, in women's magazines, saying, this is about mercury that's in fish, and lots of young mothers are worried about their consumption. But we also talk about, where does the mercury come from? It comes out of the coal in the coal-fired utility that's making our electricity. So if we fix that, we get less pollution, less mercury in a number of ways. Our chapters in public health community in Atlanta, for example, terrible sprawl, pollution, and big power plants. So they've organized also as physicians with community people to try to get these things shut down. And that's just part of the strategy. The other, frankly, is to get people engaged in the political process of this country. Individual efforts are critical. Turn down your thermometer, buy the right light bulb, that sort of thing. But the problem is so big that the public health community has mobilized to organize in key states, to get engaged in legislative advocacy and politics, because we need to change the big policies of this country.
And have you seen any success in making change, you and your colleagues in the public health community?
Yes, we have. At the federal level, suffice to say, over the past 7, almost 8 years now with this administration, it has been almost impossible. But we did, and others organized at state levels, at local levels, and so we have seen new regulations, new kinds of things in California and other places, lots of victories at the local level. That has changed public opinion. That moved and began to show up in the elections of 2006, where we got more environmentalist and pro-climate change representatives. And I think as we head into elections in 2008, you're going to see, and you already hear some of the candidates talking very strongly, that we face major challenges: the war in Iraq, the economy, and global climate change. That's new. That comes from organizing by environmental groups, public health groups, community groups, faith-based groups. People are in motion, and that's why I personally think there's a lot of hope that we're going to start moving now and get things done when we've been stalled for quite a while.
They're putting it on the agenda, so to speak, putting pressure on politicians to put some attention on it.
Definitely. Come to Capitol Hill and lobby. I cannot tell you the many, many happy hours I spent with physicians and nurses and public health scientists testifying, lobbying, and pushing so that people will understand that climate change, again, is not just some big abstract thing that happens in Kyoto. It's not just the ice melting and the lack of snows in Mount Kilimanjaro. It is literally about our families here in the United States. And that's why I think Ignition is a fabulous book for that, about social change, about the facts, but how to spark a movement. And that is key.
Go to islandpress.org for more information about Ignition, what you can do to fight global warming, and spark a movement.